Hi everyone, this is Dr. Susan Marra with Dr. Marra's Medical Minutes, and today we're going to talk about migraine headaches. As many of you know, migraine headaches is oftentimes a symptom of Lyme, Babesia in particular, and Bartonella, but it can also be a symptom of MCAS, mast cell activation syndrome, where histamine is the driving force behind the migraine. And the reason that this is important is because you can treat these infections until the cows come home, but if the etiology of the migraine is histamine, then the antibiotics aren't going to touch it. So one of the things that you can do to mitigate a histamine migraine is go on a low histamine diet, no fermented foods, and you can Google high histamine foods and remove them from your diet, and eliminate cheese and eliminate chocolate because they're histamine triggers. One of the things that is also likely involved with migraine headaches is hypoglycemia. Hypo meaning low, glycemia meaning sugar. So low blood sugar can also drive a migraine. So you need to be mindful of reactive hypoglycemia, which is frequently seen in tick-borne illness. And when you have that situation where all of a sudden you get up and you're dizzy and you just feel like you're gonna faint, it's your blood glucose signaling that you need to eat. And so one of the best things to do is to keep nuts at your desk and have a handful of nuts: macadamia nuts, pecans, almonds, cashews. Probably not peanuts, because peanuts have a lot of mold on them. So I probably would not choose peanuts. And another thing you want to avoid, if your migraine is triggered by histamine, do not drink bone broth. Bone broth is a major trigger for histamine release. And all right, so let's go back. So you want to go on a low histamine diet. You can Google high histamine foods and remove them, but for sure you want to remove fermented foods, chocolate, cheese, bone broth. Those are 4 major offenders, okay? And oftentimes when you have a migraine, it's also an indication of nutritional deficiency. And those nutritional deficiencies can include magnesium, CoQ10, and the B vitamins. So they would be things that you could add to your supplement regimen to help prevent migraine headaches. In addition to which, sometimes migraine headaches are due to vasoconstriction of the blood vessels in the brain. And one of the triggers for that is Bartonella. Bartonella lives on the inside, the endothelium of vessels. That's where it loves to hang out. And it can cause transient vasoconstriction, which can reduce the blood and blood flow to your brain. And that also can result in a headache. More likely not a migraine headache, but a bad headache. And so one of the things that I use is Diovasc, which is kind of works like an enzyme, and it helps to vasodilate. L-arginine, which is an amino acid, can help. The only problem with L-arginine is L-arginine feeds Bartonella. So if you know that Bartonella is the etiology of your migraine or headache, L-arginine would not be a good choice. Nitric oxide, that's another really great supplement to take for vasoconstriction in the brain, and something called arterosil. Arterosil sort of increases the vascular resilience, if you will. And so usually I give Diavasc and arterosil at the same time, or Vascanox. So I hope you found this information helpful, and I hope you have a wonderful day. Take care.